Okay, welcome back. We will continue our video series on medical terminology. In this video, we will cover chapter number 9, the respiratory system. Learning objectives for this chapter: define and spell the word parts used to create terms for the respiratory system. Break down and define common medical terms used for symptoms, diseases, disorders, procedures, treatments, and devices associated with the system. Build medical terms from the word parts associated with the system. And pronounce and spell common medical terms associated with the respiratory system. Alright, first we'll go over some common word parts that you'll see. Alveolo is a reference to the alveoli, which are the tiny air sacs in the lungs. Broncho is a reference to the bronchial tubes, the tubes that lead into the lungs. Hemato is a reference to blood. And laryngo is a reference to the larynx, or the voice box. Lobo is a reference to a lobe. The lungs are made up of various sections called lobes. Muco is a reference to mucus. Naso is a reference to the nose. Oxy is a reference to oxygen. And pharyngo is a reference to the pharynx, or another term for the throat. Phragmo, or phragmato, is a reference to a partition, or a divider. Pleuro is a reference to the pleura, which are membranes that surround the lungs and the inside of the thoracic cavity. Pneumo is a reference to the lung, or air, or gas. Pulmono is also a reference to the lung. And rhino is a reference to nose. Septo, reference to a septum, or a partition. Sinuso is a reference to a sinus, a cavity within the skull. Thoraco is a reference to the thoracic cage, or the thoracic cavity. And tracheo is a reference to the trachea. Alright, now we'll talk about some basic anatomy of the respiratory system. The whole point of the respiratory system is to bring oxygen into the bloodstream so it can be distributed to all the cells in the body. And in addition, its function is to remove carbon dioxide from cells and take it to the lungs so it can be exhaled out of the body. Now, the respiratory system is divided into two tracts: the upper respiratory tract and the lower respiratory tract. The upper will include the nose, the nasal cavity, the pharynx, and the larynx. And the lower respiratory tract will include the trachea, the bronchial tree, the lungs, and the alveoli, the tiny air sacs in the lungs. This illustration, we have a general overview of the respiratory system. So you have the nose here, the nostril here. The tongue is kind of pulled up at an angle, so the mouth will be here. So air would go either into the nose or into the mouth, into the pharynx, then over the larynx, then into the trachea. That will continue on to the main divisions, the bronchi, and into the lungs. Now we'll talk about some basic physiology of the system. Now, the way that oxygen gets moved from the lungs into the bloodstream is by simple diffusion, and the movement of material from an area of higher concentration to an area of lower concentration. And it's the same way for the removal of carbon dioxide. The way carbon dioxide goes from your cells into the bloodstream and into the lungs is also by simple diffusion. So oxygen will diffuse into the blood, and carbon dioxide will diffuse out of the blood. And after that, it is exhaled from the lungs. Some pathophysiology. Diseases of the system will end up reducing the amount of oxygen that the cells are normally supplied with. And when cells don't have oxygen, they can't function. So a severe respiratory disease results in death. Now, respiratory diseases can either be a congenital issue, or could be due to infections, or allergies, or tumors, or heart disease, or trauma caused by an injury. Right, some common professions that be involved with the pathophysiology of the system. The first one, the ENT specialist, ear, nose, and throat. Formal name for this profession would be an otolaryngologist. And of course, they would deal with disorders or diseases of the ear, of the nose, or of the throat. Oncologist, this is someone who studies a cancer in general. The pulmonologist, if you were to break that word down, pulmono means lung, and a logist is someone who studies. So a pulmonologist is someone who studies the lungs. And the last term here, a respiratory therapist. This is a professional who deals with people who are having difficulties with breathing. So any acute or any chronic dysfunction of the lungs would be treated by a respiratory therapist. Alright, now we'll go over some symptoms and signs, basic word parts. First, we'll start off with some common prefixes. A, or an, means without or lacking. Brady means slowly. Dis means abnormal or painful. Epi means above. And our last prefix here, EU, is pronounced U. That would mean good or normal. Hyper, in excess of. Hypo would mean lower than or less than. And tachy means fast. So Brady and tachy are exact opposites of one another. Same thing with hyper and hypo, exact opposites of one another. All right, some common combining forms that you'll see. Broncho is a reference to the bronchi, which are the divisions of the trachea. Hemo is a reference to the blood. Laryngo is a reference to the larynx, or the voice box. Ortho is a reference to straight. An orthodontist will straighten out your teeth. Oxy is a reference to oxygen. Rhino is a reference to nose. And thoraco or thoraco is a reference to the thoracic cavity or the thoracic cage. All right, now move on to some common suffixes for the system. The first one, algia, is a reference to pain. The next one, capnia, is a reference to carbon dioxide. Dynia is a reference to pain. Emia means of the blood. Oxia is a reference to oxygen. Phonia is a reference to the voice or sound. See, the suffix pnea is a reference to breathing. Ptisis is a reference to spitting. Oragia is a reference to bursting forth, usually bursting forth of blood. Spasm, involuntary violent contraction of muscle. And last term here, staxis, is a reference to a dripping or a trickling out. All right, now we'll talk about some signs and symptoms of the respiratory system. The first one, anoxia. We're going to break that term down. An means without or the absence of. And then oxia is a condition of oxygen. So this is without having oxygen. See our next term, aphonia. This is the loss of ability to speak, either because of a disease or due to injury to the larynx. See, apnea. This is the temporary stopping of breathing. And the most familiar version of this would be the sleep apnea. And our last term here, bradypnea, is abnormally slow breathing. Bronchospasm. This is having the spasms of the bronchial tubes, an involuntary contraction. This will result in the narrowing of the bronchial tubes. Cheyne-Stokes respiration. This is a reference to a particular pattern of breathing. It's an abnormal pattern that includes your breathing that gets progressively deeper and deeper. And sometimes will get very, very rapid. Then there'll be a slow decrease, and then there'll be a stoppage of breathing. And this pattern will repeat itself over and over and over again. Dysphonia. This is having difficulty in speaking because of a physical disorder of the tongue or the mouth or of the vocal cords. So having a disturbance of normal voice function. Dyspnea is having difficult breathing or labored breathing. Now compare that to eupnea, which would be normal breathing. Epistaxis is a technical name for bleeding from the nose. And our last term here, hemoptysis. We're going to break this term down. Hemo means blood. Ptisis means to cough up. So this term literally means to cough up blood. The next term, hemothorax. This is where blood will build up within the pleural cavity, which is the area in the thorax and the thoracic cavity. See, the next two terms are in relation to the levels of carbon dioxide within the blood. Hypercapnia is having an excessively high amount of carbon dioxide within the blood, and the opposite of that would be hypocapnia, when the levels of carbon dioxide are too low within the blood. And the last term here, hyperpnea, increase in the depth of breathing, as is usually a result of either being anemic or being at a high altitude or following exercise where your body demands more oxygen. So in order to get that oxygen, your brain forces you to breathe more deeply. And if not careful, this can easily lead to our last term here, hyperventilation. You are having a very rapid breathing, but your body doesn't have enough time to exchange carbon dioxide and oxygen at the proper amounts. And this will lead to an increased loss of carbon dioxide faster than your body would want. In this illustration, we have an example of a hemothorax, an accumulation of blood between the lungs, which is this pink tissue here, and the chest wall. And in between those two structures, there's a small space called the pleural cavity. So when this space fills with blood, that accumulation of blood would be a hemothorax. The hypopnea, abnormally slow or shallow breathing, and this can lead to hypoventilation, where there's such an abnormally slow rate of breathing, carbon dioxide will build up too quickly in the blood, and it's not eliminated quickly enough. So you never want to breathe too quickly or too slowly. The hypoxemia, this is having an abnormally low concentration of oxygen in the blood, and this is also related to hypoxia. Now, both of these terms, hypoxemia and hypoxia, both reference a lower amount of oxygen in the blood, but hypoxia is more of a general term. It is a reference to having less oxygen than necessary in the body. And hypoxemia is having a lower concentration of oxygen within the arteries itself. It actually has a numerical value, or that will designate that condition as being hypoxemia. Laryngospasm, we're going to break that term down. Laryngo refers to the larynx, or the voice box, and spasm, the sudden involuntary muscle contraction. This is a spasm or a muscle contraction of the larynx, of the voice box. Orthopnea is another term for dyspnea, or shortness of breath. This occurs when the person is laying flat on their back. So in order to be comfortable, they need to be propped up, either sitting in a chair or sitting up in bed. And our last term, paroxysm. This is having a very sudden, very violent outburst of an activity, such as having a convulsion or having a coughing fit for no explained reason. Sputum. This is a mixture of mucus and saliva, and that gets coughed up from the respiratory tract. Tachypnea, abnormally fast rate of breathing. Thoracalgia. This is having pain in the chest. Another word for this would be thoracodynia. So those are synonyms for each other. They both reference having pain in the chest. Alright, now we'll talk about some diseases and disorders and their word parts. Start with the prefixes, ones we've already seen before. A means without or lacking. Epi means above. Some common combining forms that you'll see. The first one, atello, means incomplete. Broncho, or bronchi, is reference to the bronchioles or the bronchial tree. Carcino is reference to cancer. A carcinogen is something that causes cancer. Carcidioid is a reference to a very particular type of fungal infection. Full version of this combining form you'll see when we get to the particular diseases. And last term on here, conio, is a reference to dust. Cyst or cysto is a reference to a sac of fluid or a cyst. Embolo is a reference to an embolus, which is a traveling blood clot. Fibro is a reference to a type of fiber. Glotto is a reference to the tongue. It can also mean speech or language. And laryngo is a reference to the larynx, which is the voice box. Myco is a reference to fungus. Naso is a reference to the nose. Pharyngo is a reference to the pharynx, which is the other term for the throat. Pleuro is a reference to the pleura, or the pleural space, the membranes that wrap around the lungs. And pneumo, or pneumonio, is a reference to the lungs, or gas, or the air. Pulmono is a reference to the lungs. Pio is a reference to pus. Rhino is a reference to the nose. Sinuso is a reference to the sinuses. And sphinxo is a reference to the pulse. Steno is a reference to narrowing. Thoraco is a reference to the thorax, or the chest, the thoracic cavity. Tonsillo is a reference to the tonsils. Tracheo is a reference to the trachea. And tuberculo is a reference to a little bit of swelling. I'll go over some word parts, or some of the suffixes that go along with some diseases and disorders. The first two mean the same thing. The suffixes of al and ari both mean pertaining to. The next one, ectasis, a dilation or a widening of. Genic means produced by or produced in. Ia is a reference to a condition. And then the suffix ic means pertaining to. The ism is a reference to a process or a condition. Itis means the inflammation of. Oma is a reference to a tumor. Then osis is a reference to an abnormal condition. Alright, now we'll talk about some particular diseases and disorders of the system. The first one, asphyxia. This is where the body is deprived of oxygen. So this is basically another term for suffocation. The next one, asthma. This is a common respiratory condition that will result in the spasms of the bronchi within the lungs, usually in response to some allergic reaction. So there's a difficulty in breathing because of the spasms of the smooth muscle of the bronchi. And that'll be related to our next term, asthmatic bronchitis. This is when a patient that already has asthma develops a very acute form of bronchitis. So this is an inflammatory airway condition. It's usually caused by a bacterial or a viral infection. But you have to have asthma first as an underlying condition, and then if you get bronchitis on top of that, then it's classified as asthmatic bronchitis. In this illustration, we have what happens during asthma, during an asthmatic attack. Over here on the left is how a normal bronchiole should look. It's wrapped around with multiple layers of smooth muscle. And the wider this space is, the more air can pass through more quickly. But when you have an asthmatic attack, these smooth muscles will constrict and tighten. So it's going to make it much more difficult to breathe. And then on top of that, there are cells that line the bronchiole that will secrete mucus. So not only will the bronchiole become constricted, it will be filled with mucus. So that makes it even harder to breathe. Which is why when someone has an asthmatic attack, when they do try to breathe, you hear that wheezing sound. Because it's the air trying to get past this very narrow space here. And then the rescue inhalers will cause this constriction to lessen, and then airway will open up. So our next term, atelectasis. This is the formal name of a collapsed lung, either a complete collapsing or a partial collapsing of a lung. Our next term, bronchiectasis. This is an abnormal widening of the bronchi or of the branches of the bronchi. And when this happens, you are going to increase the risk of infection within the lungs. So this leads to a permanent enlargement or a permanent dilation of the bronchi, which is not something you want to happen. Bronchitis is an inflammation of the bronchi or the bronchial tubes. And our last term here, bronchogenic carcinoma. This is an example of a type of lung cancer. Carcinomas are always referenced to a cancer. Bronchos reference the bronchioles or the bronchial tree within the lungs, and genic being produced by. So this is a malignant type of cancer that will develop from the epithelium of the bronchioles. Here's an example of how bronchogenic carcinoma would look. In here you have a tumor developing right here, right where the trachea splits into the primary bronchi. And the primary tumor developing here in the wall. This is a generic term for a malignant lung cancer. Alright, this is how it actually would look. This is a section of a lung taken out of a patient after their death. You can tell by the very dark color throughout the lung tissue that the person was most likely a very heavy smoker for a long period of time. It should not look that dark at all. And then this mass here, this yellowish looking mass, that is one tumor in the lung. And whenever you have a mass, especially of this size, blocking regular cells, you're going to greatly impact this lung's function. So our next term, bronchopneumonia. This is a particular type of pneumonia, which is the inflammation of the lungs. This will arise from the bronchi or the bronchioles, the small branches of the bronchial tubes within the lungs. This infection will eventually lead to the tiny air sacs of the lungs, the alveoli, to be filled up with fluid or with pus. And when that happens, then they can't work. That's related to our next term, lobar pneumonia. This is an acute version of pneumonia that will involve one or more of the lobes of the lungs. The lungs aren't just one big organ, they are divided into sections, and those sections are called lobes. So whenever you have an infection like this that affects an entire lobe, even more than one lobe, that's when it's called lobar pneumonia. Alright, next term, COPD, chronic obstructive pulmonary disease. Now, this is really a very generic, very broad term that covers a series of disorders and a series of diseases. This is any lung condition that is characterized by chronic obstruction of airflow and lung function. Emphysema is a type of COPD. Chronic bronchitis is a type of COPD. So this is a chronic, long-term condition that will greatly impact your lungs' function. So our next term, coccidioidomycosis. And this is a reference to a very serious fungal infection of the lungs. It's also known as valley fever, more commonly found in the southwestern parts of the United States. So our next term, coryza. This is any inflammation of the mucous membranes of the nose. It's basically another term for a head cold. And that leads us to our last term here, rhinitis, which is an inflammation of the mucous membranes of the nose, either caused by a viral infection like the cold or by an allergic reaction such as hay fever. But coryza is more commonly known as a head cold, and rhinitis is a more common name for hay fever. The next term, croup, is something that's associated with children. It's an infection of the larynx and the trachea, which will cause difficulty in breathing and swallowing. And a good indicator of a child having the croup is when they cough, it sounds like a very loud barking sound. And it often gets worse at night. And then when a child will cry, it makes the cough worse. And that's the more common term for the second item listed, LTB, laryngotracheobronchitis. So they both reference the same condition, but LTB is the much more cumbersome name, a much more formal name for the croup. Our next term here, CF, cystic fibrosis. This is a condition that is hereditary, and what happens here is certain glands within the lungs will produce very thick, very large amounts of mucus. Very thick production of mucus will end up blocking the intestines or the bronchi, the pancreatic ducts, often lead to respiratory infections. Next condition, emphysema. This is a condition of the lungs where the air sacs, the alveoli, have become damaged and they don't function as well. And because of that, it is harder for those patients with emphysema to breathe out. You progressively get more and more short of breath because it's harder for you to get the air that's in your lungs out. So this is a good example of a COPD, a chronic obstructive pulmonary disease. So next term, epiglottitis. This is an inflammation of the epiglottis. The epiglottis is a piece of cartilage that will close over your trachea whenever you swallow. That way, when you swallow, food and liquid will go down your esophagus into your stomach and not go into your lungs. So whenever you eat too quickly or eat too much or do both, and you start to choke, and people say that food went down the wrong way, it's because of the epiglottis not closing and sealing off the trachea quickly enough. And our last term here, laryngitis, will be the inflammation of the larynx, or the voice box. And that will typically result in having a very hoarse voice, or even a loss of your voice, a painful cough. Alright, this illustration, we have an example of emphysema. On this side, we have what a normal lung should look like. When you zoom in really close on these little clusters, these air sacs, these are all the alveoli. This is how they normally should look. But with someone with emphysema, these alveoli become overinflated. And when they get that way, they can't exchange the air properly. So it's much more difficult for these patients to get air out of their lungs. So they are continuously short of breath. And it's something that gets worse and worse and worse as you get older. Our next disease and disorder, legionellosis, is another term for Legionnaire's disease or legion fever. This is a very severe form of pneumonia, which is caused by a very particular bacteria called Legionella. Nasopharyngitis is another term for a common cold. It's basically inflammation of the nasopharynx, of the nose and of the throat. Pertussis. This is the formal name of the disease whooping cough, highly contagious, very acute condition. It's indicated by severe coughing fits, and a high-pitched whooping sound as you inhale after these coughing fits. And pharyngitis is an inflammation of the pharynx, or of the throat. Basically a formal name for a sore throat. So our next term, pleural effusion. Sometimes this is referred to as water on the lungs. This is where you have a buildup of fluid within the pleural cavity. This is the space between the chest wall and the lung itself. There's a small space to give the lungs room to expand as you inhale. And effusion in general is the escape of a fluid into a body cavity. So a pleural effusion is that fluid leaking into the pleural cavity, that pleural space. Pleuritis is the inflammation of pleura, also known as pleurisy. This can make breathing very, very painful because you are impacting the membranes that wrap around the lungs and also the inside of the chest cavity. So any kind of movement would be uncomfortable, quite uncomfortable. And the complication that usually goes along with this condition is our next term, pleuropneumonia, which is a form of pneumonia caused by pleurisy. Our next term, pneumoconiosis. This is a disease of the lungs that's caused by the continuous inhalation of an irritant like dust. Sometimes this is called miner's asthma. So this can be the inhalation of dust or any other irritants or particles from the air. An example of that would be the next two terms, asbestosis and silicosis. Asbestosis would be the disease resulting from the inhalation of asbestos particles, and silicosis would be a lung disease that's related to the inhalation of silica products in the air. Pneumonia, this is a inflammation of the lung that's either caused by a viral agent or a bacterial agent, and eventually the alveoli, the air sacs in the lungs, will become filled with fluid or pus and become solid. And there are many different types of pneumonia. It's depending on what part of the lung, how widespread it is, causes it. Pneumonitis, this is the inflammation of the walls of the alveoli, usually caused by a virus. And last term here, pneumothorax, is the presence of air or a gas that's found in the chest cavity that causes the lungs to collapse. Alright, in this image we have an x-ray of someone with pneumonia. And on x-rays like this, the areas that are kind of hazy, kind of blurry, are areas that are affected with pneumonia. So you can see a clear difference between this and then this lung. There's still some here, but very, very hazy, very blurry on this side. In this image we have an example of a pneumothorax, basically a collapsed lung. What happens is the outer membrane, the pleura, gets injured or torn, usually by some type of penetrating chest wound, like a gunshot, like a stabbing, some kind of trauma. And when you tear the pleura on the outside of the lungs, the differences of air pressure outside of the lungs versus inside of the lungs causes a buildup of air here and will basically crush or collapse your lung. Our next term, pulmonary edema. This is a fluid accumulation within the air sacs of the lungs, which makes it very difficult to breathe. Our next term, PE, pulmonary embolism. This is where you have an embolism, which is a traveling blood clot, actually enters the lungs. That's why it's a pulmonary embolism. And our last term here, pyothorax. This is an infection in chest cavity due to pus. This is also known as an abscess, because this is really just a pleural effusion, but the fluid that's building up is actually pus. Another term for this is also purulent pleurisy. Our next disease and disorder of the respiratory system, RDS, respiratory distress syndrome. RDS is a condition where you have fluid buildup in the air sacs of the lungs, and when this happens, you cannot exchange carbon dioxide and oxygen efficiently, which means not enough oxygen gets into the blood or eventually to your cells. Now, when this happens in infants, it's called NRDS, neonatal respiratory distress syndrome. Almost only happens with premature babies because the lungs aren't fully formed yet. And when this happens in adults, it's called ARDS, adult or acute respiratory distress syndrome. This is a potentially life-threatening condition because once your tissues are starved of oxygen, they will start to die within minutes. See our next condition, SARS, SARS, severe acute respiratory syndrome. It's a very serious form of pneumonia. It's caused by a particular type of virus called the coronavirus. It is extremely rare. This is also a contagious disease and can become fatal. It's not that commonly diagnosed. And our next term here, sinusitis, this would be an inflammation of a nasal sinus, so the cavities within the skull. Tonsillitis, the inflammation of the tonsils. If this becomes chronic, tonsils may be removed to prevent further infection. Tracheitis, inflammation of the trachea, the windpipe. Tracheostenosis is a narrowing of the trachea. So the more narrow that the trachea becomes, the less air is able to be moved into the lungs. So if we break down that term, of course, tracheo means trachea. Steno means a narrowing or a constriction of, and osis, a condition. So this describes a condition of a narrowing of the trachea. Next disease, TB, tuberculosis. This is an infectious disease that's a bacterial infection of the lungs. It's indicated by growth of nodules within the lung. These nodules are called tubercles. That's why it's called tuberculosis. See, next term, URI, upper respiratory infection. This is an infection of any component of the upper respiratory tract. All right, this image, we have an example of an X-ray of someone with TB, and you can tell almost right away that these clusters of white-looking tissue here, these are the tubercles. This is what is a good indicator of tuberculosis. They appear white on an X-ray. It should be clear all the way through the lungs. Down here, is normal tissue, but up here, very, very cloudy with these white clusters. All right, now we'll talk about some treatments, procedures, and devices with the respiratory system. And we'll talk about the word parts. First off, the prefixes. Anti means against. Endo means inside. Adeno or adeno means a gland. Angio means blood vessel. Broncho is reference to the bronchioles. Dilato means to dilate or to expand or enlarge. Laryngo is reference to the larynx or the voice box. So our next group of combining forms. Lobo is reference to a lobe. Now for this system, we'd be talking about a lobe of the lung. Auto is a reference to the ear. Oxy is a reference to oxygen. Pleuro is a reference to the pleura, the membranes that wrap around the lungs and the inner lining of the thoracic cavity. And pneumo or pneumono is a reference to the lungs, or to air or gas. Pulmono is a reference to lungs. Rhino is a reference to the nose. Spiro is a reference to breathing, the action of breathing. Thoraco is a reference to the thorax or the chest, the thoracic cavity. And tracheo is a reference to the trachea, the windpipe. Some common suffixes. The first two, al and airy, mean pertaining to. Synthesis means a withdrawal of fluid. And ectomy is the surgical removal of. The next two will be very related and are often confused with one another. The first one, gram. This is a record or the results of a certain test. The suffix graphy is the process of recording. ION is a process. The suffix logist is someone who studies or a specialist. Meter means to measure or to gauge. And metry is the process of measuring. The oid means derived from or resembling. Plasty, the surgical repair of. Scopy is a visual examination. Stomy would mean a new opening. You are creating a new opening. Tomy is the process of cutting. Now we'll get into some more specific treatments, procedures, and devices for the system. The first one, an AFB, acid-fast bacilli smear. This is a reference to a particular type of bacteria and its shape. Bacilli is a bacteria that has a rod shape to it. And an acid-fast bacilli smear is a test given to diagnose tuberculosis. One of the tests that's used to confirm the presence of the bacteria that causes tuberculosis. The next term, adenoidectomy, is the surgical removal of the adenoids. The adenoids are a mass of lymphatic tissue found on the back of the throat. They tend to get infected quite often, especially in children, so to have those removed isn't really that big a deal. Antihistamines. This is a type of medication that many people take to combat allergic reactions. Histamines are a chemical produced by your body whenever you have an allergic reaction. So this is why you have itchy eyes, or the dry eyes, or the runny nose, or the dry throat. You are having that allergic reaction because of histamines. So this is why you take antihistamines, so you can get rid of those symptoms and get back to normal. So our next one, ABGs, arterial blood gases. This is a test that's given to the blood to check on the levels of both oxygen and carbon dioxide. And the point of this is to check for the pH level, or the acidity level of the blood. So next term, aspiration. This is the process or the action of drawing in breath. This also means the removal of fluid and cells by suction. And our last term here, auscultation. This is the process of listening to internal organs by using a stethoscope. Bronchodilation. This is dilating or enlarging the bronchioles. And when someone is having an asthma attack, the bronchioles become very constricted, so you want to dilate those so they go back to normal. Our next term, bronchography. This is a radiographic exam of the bronchioles and the bronchial tree in general. So a radioactive dye is injected into the bronchial tree, so you're able to visualize the entire structure, so you can look for any abnormalities. And this test would produce the results of a bronchogram, so the actual record of that test. So this would be the actual radiograph of the bronchial tree after the dye has been injected. Our next term, bronchoscopy. This is a visual exam of the bronchial tree and the bronchioles. The tool they would use to do this would be a bronchoscope. Here's an illustration of how that would work. The whole process that you're seeing here would be bronchoscopy, and the tool being used right here by the doctor would be the bronchoscope. A long, thin tube is inserted into the nose, up to the sinuses, and down the trachea into the lungs. Their next term, a chest CT scan. CT scan is more commonly known as a CAT scan. So this is receiving a CAT scan of the chest. CAT scan offers much more detailed, much more vivid images than the normal X-ray would. That leads us to our next term, CXR, which is just the abbreviation for a chest X-ray, also known as a chest radiograph. And next one here, CPAP. It stands for continuous positive airway pressure. This is usually a treatment given to people who have sleep apnea or other breathing conditions, in particular at night. It's also used to help premature infants fully develop their lungs after they're born early. And the whole point of this device is to use a small amount of air pressure to keep the airways constantly open. That's why it's called continuous positive airway pressure. In this image, we have an example of what a chest CT scan would look like. As you can see, you get multiple images, multiple slices of one section of the chest. A lot more detailed images than you would on a regular chest X-ray. You can also get a three-dimensional perspective of the patient, as opposed to a 2D image that a chest X-ray would offer. Our next one is a term we've already talked about before, an ENT specialist, ear, nose, and throat. The formal name for that specialty would be an otolaryngologist. A synonym for that position would also be otonasolaryngologist. It can also be called an otorhinolaryngologist. So all three of these are all ear, nose, and throat specialists. Our next term, endotracheal intubation. This is a medical procedure where a tube is inserted inside the trachea in order to help the patient breathe. So when someone becomes intubated, this is what that is referring to. The formal name for that procedure is an endotracheal intubation. And last term here, expectorant. This is a medicine that will help promote the secretion of sputum. It's usually used to help treat coughs. So the quicker you cough up that junk in your lungs, the sooner the irritant will be gone and the coughing will stop. Incentive spirometry. This is a device that will measure how deeply you're able to inhale. And it's measured by a device called a spirometer. This is used to check multiple lung functions. An inhaler, usually carried by people who have asthma, is something that is a very small, portable device that is used to help treat asthma attacks or nasal congestion or bronchial congestion. So during an asthma attack, using the inhaler will help to dilate the bronchioles to help alleviate the pain to help lessen the asthma attack. Laryngectomy. This is the removal of the larynx, the surgical removal of the voice box. It's usually done to treat cancer of the larynx. The next two terms that will be related to each other: laryngoscopy, the process of viewing the larynx, and the tool they would use to do so would be a laryngoscope. Laryngotracheotomy. This is the process of cutting into the larynx or cutting into the trachea. Lobectomy. This is the surgical removal of a lobe of the lung. Our next term, mechanical ventilation. This is when an external device, such as a ventilator, is attached to a patient, and it is doing the breathing for the patient. It is forcing air into the lungs and out of the lungs. It is done by a machine, not by the actual person. A nebulizer. This is a device that's used to turn a liquid form of medication into a mist, where it's easily inhaled by the patient. It's usually done by having a small mask put over the nose, and you're basically breathing in very fine droplets of the medicine. Here's an example of how a nebulizer would look. This machine is turning a small amount of liquid medicine into very fine mist that this child is inhaling through this mask. And that way the inhaled droplets can go right to the lungs and work a lot faster. Our next one, oximeter. This is a device that will measure the levels of oxygen in the blood. Usually a small device that can fit on the tip of a finger. And sometimes you'll see these are not only able to measure the levels of oxygen, but they're able to monitor the pulse in that patient also. So that would be a pulse oximeter. And our next term here, oximetry, is the process of measuring oxygen in the blood. And the tool that would use to do so would be the oximeter. Here's an example of a pulse oximeter. Very small device, fits on the tip of index finger. And this one is measuring the amount of oxygen concentration, here, 99%, and also the pulse rate. So this would be a pulse oximeter, because it's measuring both of those variables. Pleurocentesis. This is the withdrawing of fluid from the pleural cavity, the pleural space, the space between the chest wall and then the lungs. It can also be called thoracocentesis or thoracentesis. All of those reference the same procedure, the withdrawing of fluid from that space. Pneumonectomy. This is the surgical removal of a part of a lung or of an entire lung. Pulmonary angiography is a process where certain dyes are injected into the blood vessels of the lungs in order to check for any abnormalities or any malformations. And so by doing so, you're able to see the entire vessel structure of the lungs. Our next term, PFTs, pulmonary function tests. This is a very broad range of tests that will measure how well your lungs are able to function. You know, how much air can they hold? How much air can you breathe in? How much air can you breathe out? How much air can you force in? How much air can you force out? And the tool that you would use to measure these various volumes and various capacities is a spirometer. Pulmonologist, a specialist who studies the lungs and diseases of the lungs. Resuscitation. This is to revive someone who has lost consciousness. And most people will recognize this term from CPR, cardiopulmonary resuscitation, which is a combination of chest compressions to get the heart beating again, and the breathing into the person's mouth to help supply the oxygen that they need. Rhinoplasty is the formal name of a nose job, the surgical repair of the nose. And an example of this would be septoplasty, which is the surgical repair of the nasal septum. Our next one, TB skin test, is a reference to tuberculosis skin test. This is a test that's given to determine whether or not you have the bacteria that causes TB inside you. And there are different types of skin tests for TB. One of those is the PPD skin test. It stands for purified protein derivative. Another example of a TB skin test would be the Manteau skin test. They both work basically the same way. You are exposed to a very small amount of the bacterium with a very small injection underneath the surface of the skin. You go back to the doctor 2 or 3 days later. If it's red, if the area is red and swollen, that's a positive indicator. That means that you have the bacteria that causes that disease. And if it's not swollen or not irritated, then you don't have it. So next terms all relate to the trachea. Tracheoplasty, the surgical repair of the trachea. Tracheostomy is the creation of an opening within the trachea by cutting into it to relieve an obstruction within the breathing. And the process of cutting into the trachea would be the tracheotomy. So here's an example of how that would look. The actual incision into the trachea here would be the tracheotomy, and the opening that creates would be the tracheostomy. Your next term, ventilation-perfusion scanning. This is a diagnostic tool that's used to image the circulation of air into the lungs. Not only the air moving into the lungs, but how well that air is perfusing throughout the lungs. So it really measures the the airflow and the blood flow within the lungs. All right, we'll go over some abbreviations that we've seen with the respiratory system. ABGs, arterial blood gases. AFB, acid-fast bacilli. ARDS, adult or acute respiratory distress syndrome. CF, cystic fibrosis. COPD, chronic obstructive pulmonary disease. CPAP, continuous positive airway pressure. CPR, cardiopulmonary resuscitation. CXR, abbreviation for chest x-ray. NRDS, neonatal respiratory distress syndrome. The NSCLC, it stands for non-small cell lung carcinoma, a type of lung cancer. PE, pulmonary embolism. PPD, one of the skin tests used to diagnose tuberculosis, the purified protein derivative. PFT, pulmonary function test. RDS, respiratory disease syndrome. SARS, severe acute respiratory syndrome. SCLC, small cell lung cancer. SOB, shortness of breath. TB, tuberculosis. URI, upper respiratory infection. And the VQ scan as an abbreviation for the ventilation and perfusion scan. Alright, we'll finish up our chapter on the respiratory system with our combining form quiz. Terms on the left: pneumo, thoraco, ortho, rhino, and broncho, all match to either air or lung. Straight, bronchus, nose, or chest. Pneumo goes to air or lung. Thoraco goes to chest. Ortho goes to the straight. Rhino means the nose. And broncho means the bronchus. Here are all 5 of the terms correctly matched to their definition. That brings us to the end of chapter number 9 on the respiratory system. We will continue our video series on medical terminology with our next video on chapter number 10.